Welcome to EMS 170 Clinical Orientation. Today I will give you an overview of the requirements for the clinicals for EMS 170. For EMS 170, you are required to complete 3 clinicals, one with an emergency department, one with an ambulance company, and one of your choice. You can either choose an emergency department, an ambulance, or a fire ride if that's available. For each of your clinicals, you are required to complete 3 things: a preceptor evaluation, a clinical evaluation, and 5 patient care reports. All of these items can be found in the clinical manual, which is in your D2L shell for EMS 170. For these requirements, you will submit the evaluations to me, and you will submit the patient care reports to your instructor. For the evaluations, you are required to complete one on the site that you visit, and the preceptor is required to submit one for you. For each of your clinicals, you are required to show up in uniform. This means you have to be in your EMS Academy polo t-shirt, tactical pants, and boots. In addition to wearing the uniform, you are required to have proper hygiene, wear no hats, and wear your student ID. You can receive a student ID from the Admissions and Records office, which is on the 2nd floor in the main building. This ID badge must be worn above your waist at all times and visible to the preceptors. For each of your clinicals, please be aware of the personal belongings that you bring. You might be allowed to store something in a locker, however, this locker might not be secure, so please don't bring anything of monetary value or that's valuable to lose. You're more than welcome to bring your textbook and study materials if you have downtime, but please don't bring anything expensive like a laptop or anything that can be lost. You are required to not have your cell phone during the clinical shifts. If you do need to keep your cell phone on you for any reason, please let your preceptor know so they are aware of why you have your cell phone. If you are caught using your cell phone, the preceptors have been told to send you home, which will count as a canceled clinical. Also, please be aware of using your camera. You are not allowed to take pictures of the patients, their family, or their charts, as this is a violation of HIPAA. Taking pictures of any of these items is reason to be dismissed from the program. For your emergency room clinical, you will be completing this with any Health One facility around the Denver area. You are required to complete 1 emergency room shift unless you choose this as your optional 3rd ride. For the emergency room, you are going to enter through the emergency room entrance rather than the main entrance of the hospital. You will approach the patient care receptionist and let them know that you are an EMT student from Arapahoe Community College. They will find the charge nurse for you, who will assign you a preceptor. The preceptors might change throughout the shift, as they do try to make sure that you have fun and interesting patients. So if they don't have a patient, they're going to switch you up and make sure that you have a good experience in their shift. The charge nurse will most likely let you know that you can store any personal belongings in the break room. You're more than welcome to bring a lunch or some kind of food item for you to eat during your shift, as it will be 8.5 hours. You will most likely get a 30-minute break unless the shift is extra chaotic, in which you'll just work through as the preceptors would. But you can store your food or any belongings in the break room. When you're in the emergency room, please be aware of all signage. Certain patients might have infectious diseases or other issues in which you want to be aware of. If you do want to enter a room that has a sign that you're not sure what it means, ask your preceptor or ask a nurse, as they will be more than willing to help you find this information out. Patients in the emergency room are often there for various reasons. Please do not offer any food or water to these patients. If you are alone with a patient and get asked for food or water, refer them back to their nurse or ask your preceptor and let them handle this situation, as you don't want to be the reason they receive something that they're allergic to or they're not supposed to eat due to the reason they're in the emergency room. Giving information to family members or to patients that's not provided by the doctor or nurse is prohibited. If a family member does ask you information about the patient, please let them know that you don't know the answer to that and you will find it out. Go and ask the preceptor, and they will get the correct information to the family member. Sometimes providing information such as everything will be okay can be harmful to the family members. If you do feel like consoling them, say, "We are working our hardest to make sure that your family member is well taken care of." If you do find yourself alone with a patient, please be sure that you are following the steps within your scope of practice. Do not try anything that you have not been taught or believe that you can handle. If you're uncomfortable being alone with the patient, tell your preceptor or excuse yourself from the room. There is no reason that you should feel uncomfortable or pressured to stay alone with a patient, as it could turn into a volatile situation. When you do attend your emergency room clinical, you are allowed to go to the helipad, the OR, or the cath lab if that is allowed throughout the emergency room. Sometimes it's very slow and the preceptors or nurses will ask you if you want to see different areas of the hospital. That is perfectly fine as long as you do stay within your scope of practice. Lifting is very important. Please be sure that you're always following safe lifting guidelines and lifting with a partner if a patient requires that. If you have any hesitation about if you're lifting the correct way, refer back to your charge nurse. If you have any other questions about your emergency department clinical, please contact me. For your ambulance and fire ride, you will need to arrive 15 minutes prior to your shift. Ambulance and fire trucks always leave on time for your shift. If you're scheduled for 7 a.m., please arrive by 6:45. If an ambulance or a fire truck receives a call right at 7, they will leave the station, and it often takes several hours before they're able to make it back to the station if they do it all that day. For your ambulance and fire ride-along, it's very important to be part of the team. There is often downtime and chores that need to be done around the station, especially for a fire ride-along. Please be sure to get involved with these chores as the crew appreciates it. This also sets a good precedent for how you are as a person and shows that you're a team player. For ambulance and fire rides, it's very important that you're aware of scene safety. When you step out of an ambulance, be sure that you're following all of the rules that you've learned in class so far. If you have any questions or you're not sure about the scene safety, be sure to ask your preceptor, as you don't want to get into an unsafe situation. For both ambulance and fire, please be sure to dress in uniform. The same uniform requirements for the emergency department are required for ambulance and fire. In addition, please be sure that you are bringing plenty of layers if it is during the cold seasons. A lot of times they do not go back to the station, so be sure that you bring those when you first leave for your clinical ride. If you do bring layers, please be sure that they are black or navy blue and have no logos on them. You are not allowed to wear anything that has any other information rather than ACC. You can purchase that at Performance if you'd like long sleeve shirts or hoodies to match the ACC EMS uniform. When you're riding with an ambulance or fire, be sure to use the restroom when you can. Many times the calls last a lengthy period of time and you might not have access to a restroom. When you're riding with the ambulance or fire crew, be sure to communicate with them at all times about where you're going, whether that be to the restroom, to check in on a patient, or any other situation. Be sure to communicate with them. Oftentimes they're in a hurry, and if they don't know where you are, they will leave you. If the crew does have downtime, you're more than welcome to utilize that time to ask questions, find out more about their agency or fire station, as well as study for upcoming exams or complete homework. Please be sure that you're not on Facebook or any other social media platform, and you're keeping your cell phone out of sight. Many times these clinical rides are utilized as an 8-hour interview, so it's very important that you present yourself in a way that you would like these places to remember you. As always, within lecture or lab, the same goes for your clinical experiences. Be sure to ask questions and learn from these experiences. These will be very valuable when you enter the field as an EMT.